Hey everyone, and welcome back. Today we're diving into a topic you might not think too much about, but it's actually really fascinating.
Oh, yeah,
Pediatric dentistry.
definitely.
We've got some awesome excerpts all about space maintenance, thumb-sucking habits,
Uh,
even those kind of confusing malocclusion classifications.
right.
So let's get right into it. I think this is going to be a really interesting deep dive.
Absolutely. Those baby teeth are more important than people think. They're not just placeholders.
Yeah, I've always wondered about that.
They really guide how the adult teeth and the jaw develop.
That makes sense.
So, yeah, there's a lot to unpack there.
So let's talk about what happens when those baby teeth come out too early.
Mm-hmm.
Premature tooth loss. What makes that, like, such a big deal?
Well, it can set off a whole chain reaction in the mouth if it's not managed right.
Okay.
You know, those gaps that are left behind need to be protected.
Right.
That's where space maintenance comes in.
So space maintenance, it sounds almost like a sci-fi term.
Kind of
Can you break that down for us? Like, when do we really need to worry about this?
imagine like a row of dominoes all lined up, and then one gets knocked over too soon.
Okay.
The others might topple into that space.
Makes sense.
It's kind of like that with teeth. If a baby tooth is lost early, those teeth next to it, they might drift into that empty space.
Uh-huh.
And then you can have crowding and bite problems down the road.
Oh, wow. So we have to hold that space open, like reserve that spot until the adult tooth is ready to come in.
Exactly. But it's not always an easy decision.
I bet.
We look at like the child's age, which tooth was lost, and how the permanent tooth is developing underneath.
Okay.
We use radiographs for that. It's like a map of what's going on under the gums.
Radiographs, those are x-rays, right?
Yeah, exactly.
So you can actually see how those permanent teeth are growing.
Yeah, it helps us measure the distance from the permanent tooth to the alveolar crest.
Alveolar crest.
It's the bony ridge where the teeth sit. So like permanent premolars, they move through the bone at a certain rate. Okay. We can use that to estimate when that tooth will erupt.
So if it's closer to coming in, you probably don't need a space maintainer.
Exactly. And of course, the position of the lost tooth matters too.
I bet, yeah.
So like if a primary incisor is lost after the canines have come into occlusion, meaning they're touching when you bite down,
Uh-huh.
space maintenance may not be needed, but if it's lost before those canines erupt, you might need a space maintainer.
Got it. So it's all about keeping things balanced, like not letting those dominoes fall over.
Right.
So speaking of maintaining space, what exactly are these space maintainers?
They're like little custom appliances, almost like braces, designed to hold that space.
Oh, okay. I was kind of picturing braces.
You're on the right track. There are a few different types.
Okay.
A common one is a band and loop. It's used when a first primary molar is lost.
Uh-huh.
There's a metal band cemented around a nearby tooth, and a loop goes into that empty space.
Okay.
We also use crown and loop, which is similar, but it uses a crown. That adds more stability.
Gotcha.
Then there's the distal shoe, which is for when a second primary molar is lost.
Okay.
Before the first permanent molar erupts, it helps guide that erupting molar.
So many tiny tools.
There are a lot, yeah. And sometimes you have bilateral loss.
Bilateral loss.
That means teeth are missing on both sides of the mouth. In those cases, we use lingual or Nance holding arches.
Wow, that's interesting.
Those go across the roof of the mouth or behind the lower front teeth to keep the other teeth from shifting.
So it's not just filling the gap, you're really guiding those teeth into place.
Exactly.
This is incredible. Okay, let's switch gears a bit, talk about something maybe a little less high-tech, thumb sucking.
Ah, yes.
Pretty much everyone's done it, right?
It's definitely a natural reflex.
But does it, like, really affect their teeth?
Well, if they keep sucking their thumb for a long time, it can affect their occlusion.
Occlusion.
That's how the upper and lower teeth fit together.
Oh, okay.
So think about the constant pressure from a thumb or finger. Right. That can lead to an anterior open bite.
Meaning?
The front teeth don't meet when you bite down.
Oh,
It can also cause a class 2 canine relationship.
what's that?
It means the upper canine teeth are too far forward compared to the lower ones.
Oh, I see.
You can also get posterior crossbites, where the upper back teeth bite inside of the lower ones, and even speech problems.
So those little thumbs can really cause some trouble. And I remember from our earlier conversations, misaligned teeth is what we call malocclusion.
You got it. Thumb sucking can make existing malocclusions worse.
Wow.
It can even create new ones. It's like those thumbs are fighting against the space maintainers.
That's so interesting. So how do you get kids to stop? I can't imagine it's easy to break that habit.
It can be tricky. but most kids grow out of it by the time they're 3.
Oh, good.
If it goes on longer than that, then we usually recommend some gentle intervention.
Like what?
It could be positive reinforcement, appliance therapy, or even psychological interventions in some cases.
Okay, so it depends on the kid. This has been so helpful. I mean, we've covered premature tooth loss, space maintainers, thumb sucking,
Yeah.
all these things that can really affect a child's dental development.
And we're just getting started.
Oh,
Next, we can decode some of the tricky dental terms like malocclusion.
okay.
We can break it down into those class types and see what they mean for a child's smile.
It sounds good. I can't wait to learn more.
So before we jump into like all the malocclusion stuff,
Right?
we were talking about how things like thumb sucking can really affect how those teeth line up.
Yeah, it's pretty amazing how it all ties together.
It is.
Okay, so let's decode some of those, I guess, confusing dental terms that a lot of parents probably don't really understand.
Right.
Like, starting with malocclusion, what does that even mean?
Well, malocclusion just means the teeth aren't aligned properly. There are a bunch of ways that can happen.
Yeah.
That's where those classifications come in.
Right.
They help us categorize those different types of malocclusion.
Okay, so let's start with class 2 malocclusion.
Okay.
We were talking about that a bit with the thumb sucking.
Right.
What makes that one unique?
It often involves what we call a distal step relationship
Distal step.
between the upper and lower jaws.
Okay.
So basically, the upper jaw and teeth are like positioned too far forward.
So like the top teeth are kind of a step ahead of the bottom teeth.
Yeah, that's a good way to think about it.
Okay.
Now, there are 2 subdivisions of Class 2,
Okay.
Division 1 and Division 2.
2 divisions. All right, this is getting a little complicated.
Yeah, a little bit. So in Class 2, Division 1, the upper front teeth stick out.
Uh-huh.
Sometimes it creates an overjet. You know those cartoon characters with buck teeth?
Oh, yeah.
That's like an exaggeration of a Class 2, Division 1 malocclusion.
Okay, got it. So what about division 2?
Class 2, Division 2, the upper central incisors, those are the 2 front teeth, are tipped back towards the palate. And the lateral incisors, those are the teeth on either side. They might be flared out.
Oh, wow. So it's like the front teeth are in a tug of war or something.
Kind of, yeah. But remember, these are just starting points. Every kid is different, so their malocclusion will be a little different too.
Of course, that makes sense.
Yeah.
Okay, so we've talked about class 2 and its 2 divisions.
Right.
So what about class 3? How's that different?
Class 3 is basically the opposite of Class 2.
Okay.
The lower jaw is positioned further forward, so you get an underbite. The lower front teeth bite in front of the upper teeth.
So the lower jaw is kind of winning the growth race.
Exactly. And with Class 3, we often like to do early correction
Okay.
to prevent those growth differences from getting worse.
So early detection is important.
Yeah, always.
Wow. It's amazing that orthodontists can, like, actually guide how the jaw grows.
It is.
Okay, let's switch gears again for a minute and talk about some other common issues that can happen in kids, even in baby teeth.
Sure.
Like, let's start with anterior open bite.
Okay.
I know thumb sucking can cause that, but what?
Well, there are other things like tongue thrusting.
Oh,
That's where the tongue pushes against the front teeth when swallowing.
Uh-huh.
And you can also have skeletal problems that cause it.
Okay.
So in an anterior open bite, the front teeth, they don't touch when biting.
Oh, wow.
You're left with a gap there.
So what other bite problems should people, like, watch out for?
Another common one is a deep bite.
Okay.
That's where the upper front teeth overlap the lower ones too much.
Uh-huh.
Sometimes the lower front teeth even bite into the gums behind the upper teeth.
Ouch, it doesn't sound good.
No, it can be uncomfortable and even damage the gums.
Okay. What about the back teeth? Are there specific things that can go wrong back there?
For sure. One common issue is a posterior crossbite.
Okay.
That's where the upper back teeth bite inside the lower back teeth.
Got it.
It can happen on one or both sides.
Uh-huh.
That can be caused by a narrow upper jaw or misaligned teeth, and it can lead to uneven jaw growth.
So we got to watch out for that.
Yeah.
So even in baby teeth, early attention can make a big difference.
Absolutely. We also see crowding and spacing in baby teeth sometimes.
Right.
Crowding happens when there's not enough space.
Mm-hmm.
The teeth can overlap or twist. Spacing is when there's too much space.
Okay.
So it's all about finding that balance and making sure each tooth has enough room.
This has been really helpful. We've
Good.
covered so much.
We have. But, we haven't even talked about the cool new stuff in pediatric dentistry.
Oh, right.
All the things that make treatment easier and more comfortable, like lasers, tiny cameras, digital x-rays.
Oh, yeah. Tell me about those. That's for next time, I guess.
It is. The future of pediatric dentistry is really exciting.
Okay, so we've spent a lot of time decoding the language of pediatric dentistry,
We have?
understanding those complex malocclusions. But let's talk about the exciting stuff,
Yeah.
the technology.
Right.
I'm really interested to hear how that's changing things for kids.
Oh, it's a really exciting time to be in the field. Technology is always changing things.
Hmm.
One of the biggest things in recent years has been digital radiography.
Digital radiography. So that's just digital x-rays.
Yeah,
They're
basically.
supposed to be a lot safer.
Definitely. A lot less radiation,
Okay, good.
which is always something we're thinking about with kids.
Well, of course.
And the images are clearer, too.
Oh, really?
So we get more details, and we can make a better diagnosis.
Makes sense.
Plus, we can see them right away on a computer screen.
So no more waiting for the film to develop.
Exactly.
That's amazing. What other cool tools are out there?
Well, laser dentistry has been a game changer.
Lasers.
We can use lasers for a ton of different procedures.
Wow.
Detecting cavities, treating gum disease, all sorts of things.
So what are the benefits of using lasers?
Well, they're more precise.
Okay.
It's less uncomfortable for the patient,
Makes sense.
and things heal faster.
So a high-tech dental toolkit.
Pretty much.
Is there anything that, like, makes the visit more fun for the kids?
Oh, yeah, definitely. Intraoral cameras are really cool.
Okay. What are those?
They're tiny cameras.
Uh-huh.
We can use them to get a close-up view of what's going on inside the mouth.
Okay.
Kids love seeing their teeth magnified on a screen.
I bet.
It's a great way to teach them about oral health.
So it's like a tiny explorer going into their mouth.
Exactly.
I've heard of, like, games and apps for kids to learn about oral health, too.
Those are great.
Yeah.
They make it fun to learn about brushing and flossing.
So important to get them started early.
Definitely. And all this technology is just the beginning.
Really?
Research is constantly moving forward. There are scientists working on new materials that release fluoride
Oh, wow.
to help prevent cavities. And there's even research into regenerating damaged teeth.
That's incredible. It is.
So, we've gone from talking about reserving space for adult teeth to, like, lasers and regenerating teeth.
I know. It's pretty amazing.
The future of pediatric dentistry is pretty bright.
It really is. And it's all about making sure that kids get the best possible care
Yeah.
so they can have healthy smiles for life.
I feel like this whole deep dive has been really eye-opening.
Good. I'm glad.
I have a totally new appreciation for pediatric dentistry.
That's great to hear. What was the most interesting thing you learned today?
I think it's the combination of science and caring that really makes pediatric dentistry special.
Yeah, for sure.
It's about using the latest technology, but also making sure kids have a good experience.
That's what it's all about.
This has been an amazing deep dive into pediatric dentistry. We talked about how important those baby teeth are.
Uh-huh.
We decoded all those complicated terms.
Right.
And we even got a glimpse into the future of the field.
Yeah, it was a great conversation. Well, thanks for joining me, and thanks to everyone for listening. Remember, a healthy smile starts early.
Absolutely. Until next time.